Welcome, family. In today's knowledge, let's talk about newborn jaundice. What can cause jaundice or increase the chances of newborn jaundice? Watch till the end as I dissect causes, symptoms, and treatment of newborn jaundice and lots more. Please subscribe and like if you haven't. After the birth of a baby, it is common for care providers to watch a newborn closely. One of the things that your care provider will be monitoring is jaundice. Jaundice is normal in almost all newborns. However, if jaundice appears out of the normal range, then steps will be taken to get it back under control. What is newborn jaundice? Jaundice is a condition that can occur in newborns within 2 to 3 days of birth. Jaundice is actually a yellowing of the skin or whites of the eyes. This is caused by elevated bilirubin levels in the newborn's blood. Jaundice normally appears first on the face and then will move down the body to the chest, abdomen, arms, and legs. Jaundice is best seen in natural light and can be harder to detect in dark-skinned babies. If jaundice is suspected, your healthcare provider will run blood tests to measure the amount of bilirubin in the blood. What can cause jaundice or increase the chances of newborn jaundice? The most common type of jaundice is called physiologic jaundice, which can affect up to 60% of full-term babies in the first week of life. It is caused by elevated bilirubin levels. Bilirubin is a substance created by the normal breakdown of red blood cells. Bilirubin is processed and removed by the liver. Jaundice will develop when a baby's liver is not efficient enough to remove the bilirubin from the bloodstream. Once the baby begins to mature and the red blood cell amounts diminish, jaundice will subside with no lasting effects on the baby. This usually happens about 1 to 2 weeks after birth. There are other less common reasons that can cause jaundice to occur. Other causes of jaundice include blood incompatibility with mom, which causes an increased release of bilirubin from red blood cells, prematurity, medical conditions such as blood clotting issues or other blood issues, excessive bruising during birth, issues with breastfeeding, bilirubin levels in full term, healthy newborns that may require treatment, serum bilirubin levels at different age of baby, above 10 mg of bilirubin when less than 24 hours old, above 15 mg at 24 to 48 hours old, above 18 mg at 49 to 72 hours old, above 20 mg at older than 72 hours. What are the symptoms of jaundice? The symptoms of jaundice include yellowing of the skin and yellowing of the eyes. Sometimes in severe cases of jaundice, a baby will seem very sleepy and have a hard time feeding. Is newborn jaundice harmful? If jaundice is left untreated and bilirubin levels reach limits exceeding 25 mg, there is the possibility of cerebral palsy, deafness, or certain forms of brain damage to occur. Jaundice in itself may not become harmful to a baby, but it may be the symptom of an underlying medical condition that can cause other issues. A less serious side effect that may occur from jaundice is sleepiness in the newborn. This can cause the baby to not eat well, which can make jaundice worse. How is jaundice treated? In most full-term, healthy babies, jaundice will resolve on its own and no treatment other than frequent feedings will be necessary. But, dependent on the levels of bilirubin in the baby's blood, and the age of the baby, a more aggressive approach to treatment may be needed. Treatment for jaundice includes frequent feedings to encourage frequent bowel movements. Bowel movements help to eliminate the bilirubin out of the body. Phototherapy. Phototherapy is a light that helps break down the bilirubin in the baby's skin. If a baby is still in the hospital or is readmitted to the hospital, phototherapy may be administered by placing the baby in a special warmer surrounded by these lights. New technology also allows parents to treat mild jaundice at home by using Billy lights or Billy blankets to reduce jaundice. Some healthcare providers feel that placing a baby near a window where he or she can receive indirect sunlight can also help with mild cases of jaundice. In severe cases of jaundice, a blood transfusion or blood exchange may be needed. Want to know more? Subscribe, like and share. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.